Hello and welcome to this lecture on pathogenesis of cellular injury. To start with pathogenesis of cellular injury, we will have to discuss the definition. It is defined as injuries to normal cell by one or more of the above listed etiologies that may result in a state of reversible or irreversible cell injury. So the main important thing is that when we talk about pathogenesis, we're talking about the list of etiologies that we discussed before. It could be the mechanical trauma, or it could be any infectious agent, or it could be a nutritional deficiency. And they mentioned in the definition that that result in reversible or irreversible cellular injuries that we discussed in the previous lecture, that a normal cell can change into pathological state, and if the stress is removed from them, then the reversible injury can be finished and the person cells or the patient cell will go back to the normal state. But if the stress persists for longer duration, then it may lead to irreversible cell injury, like in the example we discussed, ischemia, myocardial ischemia. If it prolonged, then it leads to the death. So we discussed before that cellular injuries can be classified into reversible injury and irreversible injury. We also discussed in the previous lecture that it depends upon etiological agent. So we divide the pathogenesis in general into 4 subclassification. Number 1, factors pertaining to etiological agents and host. Number 2, common underlying mechanism. Number 3, usual morphologic changes. And number 4, functional implication and disease outcome. Let's discuss one by one. When we talk about factors pertaining to etiological agents and host, then we need to understand that there is a relationship between causative agent and host, which could be patient. So a pathogenesis of any disease depend upon type of causative agent, duration of exposure, and then severity of stimulus. For example, the causative agent for COVID-19 is, we all know, is coronavirus. And we technically term as coronavirus 2. The causative agents could be any bacteria as well, as we discussed before. Second thing is the duration. For example, a patient is having how much exposure for how much time, for how many days. Then the severity of the stimulus. When we talk about severity, we can understand with one example, like the mortality rate. And for example, in coronavirus COVID-19, the mortality rate is 2.3% as compared to influenza virus, where the mortality rate is 0.1. So you can compare the mortality rate of coronavirus COVID-19 with influenza virus, and from that you can determine the severity of the disease. When we talk about duration of causative agent, then it varies widely from short-term duration to long-term duration. Even sometimes some disease with short-term duration can be dangerous, or long-term duration can also be dangerous. We cannot generalize them. For example, short duration of ischemia can cause reversible cell injury, but if it persists for longer duration, it could become irreversible. Then when we see the relationship between causative agent, then we have the host. And when we talk about the host cells, we need to know some of the things. So to understand the pathogenesis in context with the host, we need to know susceptibility to injury, patient nutritional and metabolic status, and adaptation of the cell to hostile environment. Adaptation of cell to hostile environment. For example, skeletal muscle can withstand with hypoxia for longer duration as compared to cardiac muscle during ischemia. So we must need to understand that our host cells are very important, and we must need to understand that a patient uh, which cells are affected by certain pathogen. For ischemia on the skeletal muscles have less effect as compared to ischemia on the cardiac muscles. So the pathogen is important, but the host is also important. Their cells are important. Which cells are exposed to that pathogen? Then the patient is nutritional and metabolic status is normal. Like if a patient is diabetic, then the pathogenesis uh, would be different. Or nutritional, if a patient is anemic, is patient is already anemic, and then patient exposed to certain disease like myocardial ischemia, then it will have a different effect. The second thing we need to see is the common underlying mechanism. This is the first thing that we discussed in the previous part. Now let's discuss common underlying mechanism. Common underlying mechanism are very important. When we talk about common underlying mechanism, it is very important. It depends upon the following things. The common underlying mechanism, it could be the damage in the mitochondria, causing ATP depletion. As we all know that ATP is responsible for producing energy, and mitochondria is responsible for producing energy. So if the damage in the mitochondria, it will affect the production of energy, and it can cause complications, or it can cause the problem. Then the second thing that we discuss in common underlying mechanism is the cell membrane damage. And when we talk about cell membrane damage, we can give you one example of cholesterol homeostasis. For example, cholesterol homeostasis. Many neurodegenerative diseases are linked to cholesterol homeostasis. For example, Alzheimer's disease. Then we have the release of the toxic free radical. The third point is under common underlying mechanism is release of toxic free radical. For example, ROS, reactive oxygen species, which will be produced due to drought, salinity, chilling, nutritional deficiency, metal toxicity, or UV radiation. And these reactive oxygen species are responsible for cellular damage and can cause cancer. So we must know that when we talk about common underlying mechanism, three things are important. Number one, damage in the mitochondria. Number two, cell membrane damage, for example, cholesterol homeostasis in case of Alzheimer's disease or any neurodegenerative disorder. And the third is the release of the toxin, free radical. For example, ROS, reactive oxygen species, that is responsible for cancer. So go back to the slide and we see the third point, which is the usual morphological changes. And when we talk about the morphological changes, we're talking about the gross changes and microscopic changes. Usual morphological changes. And when we talk about usual morphological changes, we're talking about gross change, or we're talking about microscopic change, such as morphology of the organs. We're talking about organ changes, changes at organ level. Gross mean on a bigger scale, where microscopic changes are seen under the microscope. We will see the cellular changes. The last thing is the functional implication and disease outcome. And when we talk about functional implication and disease outcome, we need to know the clinical sign and symptoms. Functional implication and disease outcome. And when we talk about functional implication and disease outcome, we need to know the series of events in a disease. In simple terms, like in coronavirus, some patient come with mild to moderate illness, And if the patient is not treated, it or for example the immunity has not been developed, then it can lead to serious or critically ill. So a series of even in any disease is very important. And then the clinical sign and symptoms, patient coming from what sign and symptoms? It also depend upon the treatment, because sometimes some patient can be treated with one drug, sometimes multiple drugs can be given if in case of complication. Sometimes one kind of drug is effective for one patient, but same drug is not effective with the other patient, because it depends upon the biological nature of disease, biological nature, or we can say behavior of disease. The most commonly pathogenesis in the disease are linked to the interruption of the blood supply or interrupted of the oxygen supply to tissues, and they are common form of cellular injuries which can lead to death. Uh, we will discuss the pathogenesis of ischemia and hypoxia later on in the systemic disease in the cardiovascular system. This is not the topic in our today's lecture. So thank you so much for this lecture. Thank you.